Welcome to Dining with Diabetes. My name is Sarah. I'm a registered dietitian and the Nutrition, Health, and Wellness Agent for K-State Research and Extension, Sedgwick County. I want to thank you for your interest in this class. I'm sorry we can't be together in person, but I hope this will at least give you the information that you're needing. You are welcome to get a hold of me at any time if you have questions. Please feel free to email me. My email address is on this first slide, Sarah, S-A-R-A, SAR, S-A-W-E-R, at ksu.edu, or feel free to call my office and leave a voicemail and I'll get back with you. That number is 316-660-0118. This class allows us to meet for 4 weeks with a 3-month follow-up class. You will learn what it means to eat well with diabetes, focusing on a different aspect of choosing a healthy meal plan each week. I encourage you to attend all the classes as you're able so that all the information will make sense as a whole. Please keep in mind this class is not intended to replace what your doctor has told you, maybe your dietitian or your certified diabetes educator, but it's to supplement and to reiterate what they have told you. So today's session, we're going to talk about self-management. So some things to look for and some questions to talk to your doctor about. Class 2, we'll talk about carbohydrates and artificial sweeteners. Seems like everybody has questions on those. Class 3 will cover fats and sodium. And then class 4, we talk about vitamins, minerals, fiber, and we kind of wrap up meal planning. And then our 3-month follow-up class is where we come back together and we talk about if there's any issues or barriers or challenges, what successes you've had, and then we will talk about eating out at a fast food restaurant and how to make some healthier choices while doing that. So these are the goals of the program. We're hoping that you will walk away and know more about the relationship between diabetes and nutrition and physical activity. As I said, we're going to discuss some ways to better manage your disease. You will receive some healthier recipes, and I understand that Bonnie and Hannah are going to prepare these for you, which is exciting. You're going to learn about healthy cooking techniques. I hope that you'll have a little more confidence in managing your diabetes and knowing what to look for and knowing what questions to ask your provider, and also interact with the others in class. I think that's important that we can all learn from each other. And so I hope that you'll have that opportunity in this class to learn what others have been doing and what's worked for them, and maybe take some of those ideas home and have them work for you. Module 1 will cover how insulin and glucose interact in your body, examine the different types of diabetes, look at some terms used to describe diabetes, and discuss tests your doctors use to diagnose and treat diabetes and its symptoms. We will also talk about the emotions that diabetes brings, set a short-term goal, and best of all, learn how to prepare some delicious and healthy foods. As you may know, diabetes has become a public health crisis. Diabetes is common, serious, and costly. Worldwide, approximately 8% of the population has diabetes, which is mostly type 2. In the United States, 1 of 11 people, or about 9% of the population, which includes children and adults, have diabetes. The prevalence continues to rise. In Kansas, diabetes occurs in approximately 1 of 11 people, which is approximately 9% of the population. By 2050, it's likely that 1 of 3 adults in the United States will have type 2 diabetes. It's the eighth leading cause of death in Kansas. The prevalence in Kansas has doubled from 4.2% to 8.8%. Diabetes is no longer your mother or grandmother's disease. So many people in our country have been diagnosed with this condition. Some of you may remember an insulin bottle sitting on the shelf in the refrigerator if one of your relatives had diabetes and thought that only old people had this. But now, many of us have friends, colleagues, and relatives who have diabetes, and they are not only senior citizens. Diabetes can be a heavy burden financially, medically, emotionally, and physically for the person with diabetes, but also for families and the healthcare system. So what exactly is diabetes? We've all heard this term for many, many years, but when it comes down to defining it, what does it mean? I found this really great video that I wanted to share with you today that really breaks it down to a visual level that you can see what's happening in your body. Basically, your pancreas has either stopped functioning or it's not functioning like it should. Therefore, you've got too much of that blood glucose in your blood. But I know sometimes it can be really confusing learning when and what to eat, why your blood sugar's high or low, when or how to exercise, and when to take your medication. That can be a lot when you're first diagnosed, but certainly if you've had diabetes for years. That's why it's so important to know your body. Know when things don't seem right, don't feel right. It's important that you know these signs and symptoms that we're going to talk about today, and also to have a relationship with your physician. If you have any questions, calling, leaving a message for the nurse, that's really important to keep that constant communication so that you can be in charge and know what is going on with your diabetes. Type 1 and type 2 are the most common types of diabetes. The difference is whether your pancreas is still making insulin or not. So with type 1, your pancreas no longer produces any insulin. With type 2, your body is not using that insulin correctly, as we saw in the video before this. With type 1, your body weight can be normal or considered underweight. So your physicians determine this based on your body mass index. It's one indicator for assessing body weight. It may not address muscle tissue and body composition. So for an example, if you have a very muscular man, his BMI may be over the healthy range, even though body fat isn't excessive. So it's not the best indicator, but it's one indicator, a way to assess your weight. So a healthy BMI is 18.5 to 24.9. So typically those with type 1 have a body weight that's considered normal, underweight, or below. For overweight individuals, their BMI is 25 to 29.9, obese 30 and above. So typically those with type 2 diabetes are considered overweight or obese. With type 1 diabetes, diet and exercise can help control their diabetes and also can help control how much insulin is needed, but they have to take that insulin to live. With type 2, diet and exercise can certainly help control those blood sugars and possibly keep them off from pills or insulin, but they may need them at some point. Do you have diabetes? You may have heard these terms used by your healthcare professional or in your community. If you are hearing these terms, do not take them lightly. When doctors test for diabetes, they measure the glucose in your blood. Glucose is often called blood sugar. If the results of your blood test indicate that your glucose levels are above normal, Some may say that your sugar's a little high, or you have a touch of sugar. Prediabetes is another term used for this condition. If your healthcare provider uses these terms, ask for an explanation of what the terms mean for you. You may be able to bring your blood glucose to normal levels through better eating habits, increased exercise, or weight loss. You may develop type 1 or type 2 diabetes down the road, but attention to healthy habits can delay the need for medication. If you have been diagnosed, how do you feel about having diabetes? Do you feel like it's no big deal? Are you worried, scared, overwhelmed, feel empowered, maybe angry, or even feel doomed? All of these responses are normal. Even when people have diabetes for many years, they can get tired of the effort that is needed to keep blood glucose numbers in their target range. Attending classes like this one can provide some support, new recipes, new friends, and reinforce the importance of taking care of your diabetes. It is very important to stay diligent with your diabetes management, as you'll see as we continue with this module. When diabetes is uncontrolled, the extra blood glucose in your blood can cause damage to your body. Some symptoms are nerve pain, blindness, heart disease and stroke, kidney failure, sexual dysfunction, and loss of limbs. The great thing is, as mentioned in the previous video, complications don't have to happen. With control of blood glucose numbers, diet, exercise, and taking your medications as prescribed, you can limit complications related to diabetes. As people live longer with diabetes, their medications may change, and people with type 2 diabetes may need to take insulin as their pancreas decreases output. However, keeping complications at bay with positive behaviors and medications can let people with diabetes live full and active lifestyles. So can you tell me what this picture is? That's right, it's smoke. And where there's smoke, there's fire. So these serve as your smoke alarms or your wake-up calls to managing your diabetes. These tests are markers for your health. They can indicate a problem when it's in its early stage and while there is time to keep it from getting worse or even reverse it. We're going to talk a little bit more about each of these tests. Hemoglobin A1C is also called glycated hemoglobin. It's a measure of how much sugar is attached to the red blood cell. When sugar attaches to red blood cells, it also attaches to other proteins in the body, such as the proteins inside your blood vessels. It takes 3 to 4 months to change, so it is a measure of long-term blood glucose control. You can get an accurate measure of hemoglobin A1C without fasting before your blood is tested. People who have diabetes should maintain an A1C value of 7% or less. An A1C range of 5.7 to 6.4% identifies individuals with prediabetes. People without diabetes usually have an A1C of 5% or less. Do you know why we don't recommend trying to get your A1C down that low if you have diabetes? Studies have found that the risk of complications with an A1C of 7% compared to 5% is not great, and it's difficult to reduce that A1C to that level when diabetes is present. The A1C test should be repeated every 3 to 4 months. If your A1C is too high, here are some actions you can take to help lower it. You may have a meal plan that was designed for you by your dietitian or diabetes educator. If not, we will show you a very simple way to plan your meals that includes good choices for people with diabetes. Not everyone will need medication, but it is helpful for some. If your doctor has prescribed medications, it's important to take them. Also, if your doctor requires you to test your blood sugar, please do so, especially after meals. Many people don't realize how high their blood sugar can get after meals. If your A1C is too high, increase Increasing the amount of physical activity throughout the day will help lower blood glucose because cells need the glucose for fuel and it improves circulation. While physical activity cannot cure diabetes, it can improve your health and help with diabetes control. Physical activity has numerous health benefits, as mentioned on the last slide. It moves glucose into your muscle cells without insulin. The larger the muscles that are moving, the more glucose they will use. It strengthens muscles including the heart muscle and the muscles that control breathing. Activity that you do on your feet strengthens the muscles that keep you from falling and the muscles that protect your bones and make them stronger. It decreases stress levels, which make your body feel healthier overall and more able to fight off infection and lower the risk for chronic disease. Physical activity makes a big difference in how well we age. For many people, physical activity improves emotional health and decreases depression. 30 minutes a day of moderate activity is a minimum. Moderate activity is a brisk walk. That is walking like you are going to miss your bus. What are some other examples of moderate exercises? Things like swimming, riding a bike, hiking, some housework, and gardening are all examples. More activity than 30 minutes a day means greater benefits. Your doctor may want you to monitor your daily blood glucose at home. Some people with diabetes do this multiple times a day and others less frequently. Keeping your blood sugar in control is key. Monitoring the level before a meal and 2 hours after the start of a meal will let you know if you are succeeding in controlling your blood sugar. If you are using insulin, some people can adjust the amount of insulin as directed by their doctor. Do not self-diagnose and adjust your insulin unless your doctor has approved this approach. Your numbers will vary from day to day and are affected by meal content, your physical activity, stress, and other factors. Do not get discouraged if your numbers are not consistent. Tell your doctor if they are consistently high or low. Blood pressure is a measure of how hard the heart has to work to pump the blood through your body. When blood pressure is high, your heart has to work harder. If your blood pressure is not on target, meal planning, physical activity, maintaining a healthy weight, and medications can help. If you are smoking, quitting will help control your blood pressure. Work with your healthcare team to plan your strategy. It is better to have your blood pressure checked by a trained professional as the machines in the grocery and drug stores are not very accurate. You should have your blood pressure checked at every office visit. Your goal is a blood pressure of 140/90 if you have been diagnosed with type 2 diabetes. However, please check with your healthcare professional as they may have different goals for you. So what are some ways that you can lower your blood pressure? Look and see what's at the top of this list. Increasing your physical activity. That is going to be essential in lowering that blood pressure. Also, as mentioned earlier, if you smoke, stop. Lose a little weight. Losing 5 to 7% of your current body weight makes a big difference in your blood pressure. If you're on medication to lower your blood pressure, take it as instructed, whether you feel like you need it or not. Many people cannot tell when their blood pressure is high. And lower your intake of salt. You can do this by eating fewer canned and processed foods and by not adding salt to your food at the table. In the next module, we will talk about ways to add fresh herbs and spices to flavor your food without the added sodium. A serious complication of uncontrolled diabetes is kidney damage. High blood glucose destroys the small blood vessels that filter our blood to remove impurities. Doctors can determine your kidney function or glomerular filtration rate through a blood screening. Estimated glomerular filtration rate, or GFR, is a test used to check how well the kidneys are working. Specifically, it estimates how much blood passes through the glomeruli each minute. Glomeruli are the tiny filters in the kidneys that filter waste from the blood. Microalbumin has been used to indicate whether your kidneys are functioning normally in the past, but recently the GFR is being recommended as it is more sensitive. You may find your provider uses one of these tests. Checking for kidney damage should be done once a year. When your LDL or bad cholesterol is too high, it can build up in the walls of the blood vessels and cause them to be narrow so blood doesn't flow through easily. This is often the cause of heart attacks or strokes. It can also lead to damage to the tissues that are fed by those blood vessels, such as your kidneys, your feet, and eyes. Additionally, this can lead to blood clots that can break off and travel to the heart, otherwise known as a heart attack, or to the brain, which is known as a stroke. Blood clots can also cut off circulation to the legs or other parts of the body. These events can be fatal. Cholesterol and lipids are separate types of fat that circulate in your blood. High triglycerides, along with high LDL and low HDL, can also increase the risk of heart attack and stroke. Genetics have a big influence on your cholesterol levels and the type of cholesterol in your body. You may not be able to control these numbers, but there are some behaviors that lower the risk of heart attack or stroke from high cholesterol. Some of these will sound familiar, like quitting smoking, weight loss, and increasing physical activity. Also, changing your diet will be incredibly helpful, so make sure to eat less solid fats and sugar. Eat more vegetables and fruit, as they have vitamins and other substances that prevent damage to the blood vessels and lower your risk for heart attack and stroke. Additionally, quitting smoking, weight loss, replacing some monounsaturated fats with saturated fats, and increase of physical activity may increase HDL levels. No one wants to lose their eyesight, so keeping blood sugar stable is essential in maintaining proper eye health, as high blood sugars can damage eye vessels, resulting in eye disease. As you can see, protecting your eyes means controlling your diabetes and your blood pressure. A yearly foot exam by your healthcare provider is a must to prevent losing a limb. Consider checking your feet daily with a handheld mirror. If you have signs of nerve damage, avoid going barefoot. Just as is recommended for people without diabetes, a visit to the dentist should happen twice a year. Diabetes can impair blood circulation in the gums, and people with diabetes are twice as likely to have gum disease. Managing your diabetes can be challenging. It usually gets easier with time. It is important that you work with your doctor and other healthcare professionals, such as a dietitian or diabetes educator. Keep your appointments, take your medications, follow a healthy meal plan, and include exercise in your day. Check with your insurance plan to see if they will pay for a membership at a Y or health club in your area. If you have questions or problems, call your doctor. They need your input to create the best plan for you. And address those smoke signals so they don't develop into diabetes complications. With 30 million other Americans with diabetes, you are not alone. And each and every small step in the right direction, whether it's learning how to count carbs, checking blood sugars regularly, or starting to exercise, are all steps in the right direction toward better health in managing diabetes. Each week, we will set a short-term goal to work on. We call these SMART steps because the acronym SMART guides us to setting goals that we can achieve. Thinking about what we've talked about today, what is one thing you can go home and change to take better control of your diabetes? So here's some tips on how to set a SMART step. So make it specific. Detail exactly what you want to do. So for example, I will check my blood sugar before meals and 2 hours after meals to evaluate my blood sugar control. Make it measurable. Your goal should be something that you can measure to see if you've accomplished it or not. So another example, I will write down these blood sugars in a log on one weekday and one weekend day. Make it attainable. Don't set yourself up for failure. Make your goal something that you can actually accomplish. So, example, bringing my supplies with me and setting an alarm for blood sugars after my meals will help me remember and achieve my goal. Choosing 2 days of the week is not too overwhelming. What would happen if we said we were going to do this 7 days a week? If we messed up one day, we might get frustrated and overwhelmed and forget it. So let's just start small by choosing 2 days. Make it relevant. Your goal should be related to what it is that you're trying to accomplish. Example, this goal will help me gauge my diabetes control and show areas where I can improve. Make it timely. The goal that you set should be time-bound, meaning that you should give yourself a specific amount of time to accomplish it. I will log my blood sugars on one weekday and one weekend day within the next week. So your SMART step will look like, I will log my blood sugars before each meal and 2 hours after meals on one weekday and one weekend day within the next week to evaluate my blood sugar control and determine areas for improvement. So it looks like I ran out of time on that slide. I apologize. But just make sure you have your SMART step sheet somewhere where you can see it on a daily basis to remind you of what you're working on. So maybe tape it to the refrigerator, maybe tape it to your bathroom mirror, somewhere that you can constantly be reminded of your goal. So in our next session, we're going to talk about carbohydrates and artificial sweetener and how they can fit into a healthy meal plan. In the next week, I want you to think about the smoke alarms that we discussed today and if there are any improvements that you might be able to make. Again, I want to thank you for your interest in this class, and I know me talking through a PowerPoint is not the most exciting, and I hope that you got some information out of this that you find helpful. I'm sure you'll love seeing the food demonstration and tasting the food. I always think that's the best part of the class. But again, if you have questions or comments, please feel free to reach out. Again, you can email me at sarasawer@ksu.edu, or feel free to call me at 316-660-0118. So thank you so much, and I will talk to you at the next session. Bye.